Good morning, and thank you for joining us today with taking time from your busy schedules. My name is Sherry McFarland. I am from Volusia County. I have two teenagers with a dual diagnosis of autism and mental illness. This is Carmen Brown. She's from Orange County. Christina Troop from Clay County, and also Shannon Uby from Clay County as well. We're here to spotlight a very overwhelmed, complex, and very broken system in the state of Florida, which is mental and behavioral health. Our kids happen to fall into a very special group of people, those with developmental disabilities and also mental illness. This group is particularly at high risk of falling into crisis situations when those services are hard to come by. According to CDC data, we have 34% of Floridians with disabilities reporting suffering from depression versus only 9% of non-disabled Floridians. Even worse, 54% of adults with disabilities report multiple mentally unhealthy days within the past 30 days versus only 30% of non-disabled adults. Floridians are struggling to get the help that they need, and there are many barriers that they have to overcome. There are long waiting lists for providers, lack of appropriate funding and insurance coverage, lack of community supports like transportation and personal care assistance to get to the appointments when they can finally get them, and professionals who lack the training on how to treat the very specific issues that face our loved ones with developmental disabilities and mental health challenges. The only way we get help is when situations escalate to a crisis, and even then, the help can be very elusive. The cost of failing to provide mental health care is quite simply not acceptable. It's institutionalization of our loved ones, criminal justice involvement, or loss of life of the person or the caregiver through either suicide or homicide. To put this into numbers, Florida's budget included $718 million for mental health care versus over $1 billion for providing those exact same services within the prison system, but for far fewer people. In relation to other states, Florida consistently ranks at the bottom when it comes to mental health. We spend only $37.28 per person per year on mental health services. That puts us at 49 out of 50. Only Idaho is lower. That means that our southern counterparts like Alabama, Mississippi, Tennessee, they're all above us. On the other hand, we have Maine at number 1, spending $345.36 per person. That is 10 times more than what Florida spends. Florida also ranks 49th in the percentage of adults with a mental illness. This is likely an underreporting because there is a lack of access to that care. The one area we rank number 1 in, there were over 43,000 online searches for a mental health therapist in the state of Florida for every 100,000 people. For comparison, number 2 was Virginia. They only had 19,000 searches, so we more than doubled that. The citizens of Florida are desperately seeking help, but they are not finding it. They are finding waiting lists, they are finding denials, they are finding frustration and exhaustion. We are at our breaking point, and we need you, our legislators, to act.
Hi, my name is Carmen Brown. I am a mom of 3 children, uniquely on the autism spectrum, and suffer additional comorbidities. I am also a fellow military spouse. First, I would like to say thank you to all the policymakers and fellow partners for attending today. I am not a native Floridian, but have considered Florida home for the last 4 years. In the last 4 years, my family has fallen prey to the broken mental health system that is deemed not to be a problem according to the World Atlas report in 2015 that states only 17% of Florida population suffer from mental health issues. I am here to challenge that fact with additional facts and personal testimony. According to FloridaVets.org, Florida has the 3rd largest vet population with 1,492,000, with 20% of them suffering from PTSD. A report released in April of 2022 by the DoD stated that suicide against service members is the worst since 1938, averaging 44 per day. My husband is a 20-year Army vet who served his nation proudly, but on July 4th, 2021, who was there for him when we had to call the crisis line due to a firework being set off too close to the house that resembled an explosion that was seen numerous times during deployments. I called the crisis line only to be placed on hold, asked a series of generic screener questions, placed on hold once again, and then hung up on. I called again, and someone assured me that they would be calling us in the morning. Might I add that we never received the promised phone call. Policymakers, you have failed the mission. In a report issued from NAMI December of 2022, 512,000 Floridians are uninsured with mental illness. 1.8 million Floridians do not get the treatment, and there's an average of 1,343 people on a wait list for services. Florida has yet to expand Medicaid with federal funds, leaving almost 50% of adults without mental health services because they cannot afford it. This leads me to my next point. My oldest son, who has autism, epilepsy, and a history of depression and anxiety, has always received mental health services in school in various states since kindergarten up until the last 3 years since we resided in Florida due to shortages. I then started seeking services, only to be met with, we don't accept Medicaid, our waiting list is over a year, so then our only option became seeking private pay, which is $125 a week, $500 a month, and the question I now have to ask myself is, which bill will we forgo or be late on? Will it be rent, electric, or food? Policymakers, you are failing our children. We need you to hear us. We need you to hear our cries for help, to have reoccurring funding in the mental health budget that would support the increasing population of 1.9% that was reported from the census from June 2021 to July of 2022, totaling 320,000 people per year. I will now pass it off to Christina.
Good morning, everyone. Thank you so much for being here today and spending time listening to us speak on this extremely important topic. My name is Christina Troop, and I am the mom of a 13-year-old. I wish I were here to discuss how amazing she is and how she is capable of incredible things, because she is. Unfortunately, instead, I'm here to tell you about how, in July, she tried to kill me. This was the second time she had done so, but this time was much more serious, giving me a concussion and choking me to the point of breaking bones. My daughter has a mental illness along with a developmental disability that causes her to act at times with extreme violence and aggression. While this incident has been hard to recover from emotionally and physically, I am most pained by the haunting notion that this was entirely preventable had my daughter gotten the level of help she needed. Like many other families in our situation, we asked for help several times before crisis hit. Often, we just never heard back, later finding out the programs we were referred to didn't exist or were too underfunded and understaffed. Sometimes we would hear back and find out we were one zip code away from having access to that specific service. Other times, she was precluded from help because of her comorbid developmental disability. Ultimately, it took my child getting arrested to start getting any access to mental health care, and that in itself took months of effort to secure. The intervention and outpatient services available were just not enough. Action on homicidal ideation is serious, especially repeat instances. Our daughter now needed a long-term psychiatric facility. It can be nearly impossible to secure a bed in a facility like this, especially for children with dual diagnoses of mental illness and developmental disability. Some families wait for over a year, and private insurance often doesn't pay for these stays for long, if at all. Luckily, my daughter was adopted from foster care and thus gets Medicaid, but I worry about families without this help. I also worry because despite wanting my little girl home, I am afraid. Will she be coming home to the exact situation we were in before July? The same lack of services and support? I worry that if she doesn't have the help she needs, she will end up in jail where she doesn't belong. I worry we will be like the family of the Brevard County 17-year-old who stabbed his mother nearly to death in November. He is now being charged as an adult with attempted murder, not getting mental health care. How many times did his mother reach out for help? My family can't afford to wait for such a tragedy. I often think of a time I reached out to a local agency for help. Instead, I was told by the supervisor I spoke with that there was no magic wand to get my child the help she needed. I promise you, I am not waiting around for a magic wand, but the services and the funding needed to run them just don't exist. In lieu of services, we've often been told our only option left is to send my child back to foster care. In a state that claims to care about parents' rights, it is shameful that we can't even afford the most basic of mental health care, and instead we leave families with the only option of relinquishing their children to the very state that failed them in the first place. Foster care is not an appropriate substitution for mental health care. My child and others like her need access to high-quality, comprehensive mental health care, including behavioral services, especially children with a developmental disability and a mental health disorder who face extra challenges in receiving the care they need. My daughter doesn't need a magic wand. She needs help, and we need change. Thank you for your time.
Today you have heard from two of the thousands of people that are personally affected by the lack of mental and behavioral health care and services in Florida. According to Mental Health America, Florida ranks 49th in the nation to access to mental health care, and this ranking is based on 9 measures, ranging from adults and youth who did not get treatment, to those who are uninsured or unable to afford care, to the availability of mental health workers. No single budget exists for mental health funding in Florida. Money for behavioral health programs is appropriated to several state agencies and flows to local organizations. That makes the mental health system fragmented and sliced. This is not about just throwing whatever mental health care that is available to someone. It's about doing that accurate assessment and being certain that we connect them with the right treatment. Treatment that will be able to provide timely intervention and services to all people. Every mental health system requires carefully balanced levels of care. That continuum of care includes state hospitals, short-term acute inpatient, and intermediate care facilities, crisis centers, and outpatient services like assertive community treatment, supported housing, and independent living options. When community services are not available, the entire system backs up. Long waiting lists, reduced access. People languish in hospital beds because they can't be placed elsewhere or can't be discharged because outpatient services aren't immediately available. Overcrowding and shortages arise. Closures, reductions, and conversions in private hospitals and other private facilities aggravate these problems in the public system. With the passage of federal parity law, along with the Affordable Care Act and the decision by 32 states to expand Medicaid, Americans should have better access to mental health care than any time in history. Yet people with mental health conditions who have insurance still struggle to find providers and services in network. Governor DeSantis said that he would advocate for expanded access to mental health and substance abuse treatment and early prevention programs. He didn't specify that he would improve Florida's mental health ranking as compared with other states, or that he would increase funding by a specific level. In 2022, Governor DeSantis did sign the budget, which included $126 million in recurring revenue for mental health funding. What we are asking for today is to continue with this recurring budget with an annual increase of 5%, so that the state can align with the Florida Developmental Disabilities Council request for active recruitment for qualified mental and behavioral health providers. Thank you for your time.